This session will discuss the topic related to strategic planning and goal setting within a healthcare organization and what this means for the nurse manager or leader. So let's look at our objectives. By the end of this discussion, you should be able to discuss the value and importance of conducting an environmental assessment, identify the value of marketing plans in healthcare, define the purpose and identify the steps in the strategic planning process, evaluate the use of select functions, principles, and strategies for initiating and managing change, apply quality management principles to clinical situations, and explain how quality improvement affects the patient and the organization. What is strategic planning? It's a process designed to encompass the organization's emphasis on mission statements, strategic action plans, changes in policies and procedures, environmental factors, and the development of new services. The strategic planning process involves appraisal or assessment of the environment, appraisal of the organization's strengths and weaknesses, identification of the major opportunities and threats, development of strategies to meet these opportunities, and implementation and evaluation of the strategy. In the assessment of the environment, let's look at the external environment. There needs to be an assessment of the impact of opportunities and threats within the environment. For example, the economic and demographic factors. In the internal environment, there is a review of the effectiveness of an organization like the structure, size, and human resources. Identification of the organizational strengths and weaknesses requires understanding the mission statement, which reflects the purpose and the direction of the healthcare agency or a department in it. Philosophy, which provides direction for the agency and or department within it, and goals, which involves the process of developing, negotiating, and formalizing the targets or objectives of an organization, and objectives, which involves the ability to be able to write clear and concise objectives of the organization. Strategies involve identifying major issues, establishing goals, and developing strategies to meet the goals. Implementation and evaluation of strategies entails the review of strategic plans to determine whether the goals, objectives, and activities are on target. Specific plans for action or implementation include open communication with staff, formulation of revised policies and procedures, and formulation of area and individual objectives. Marketing involves activities designed to generate and facilitate exchanges intended to satisfy human wants and needs. The market planning process is as follows: assessment, planning, implementation, and evaluation. In assessment, you need to determine organizational level mission, objectives, and goals. You need to be able to analyze organizational strengths and weaknesses, analyze external threats and opportunities, and set marketing missions, objectives, and goals. Planning involves development of a marketing plan. The plan outline has the service or program to be provided, detailed budget cost analysis, promotional activities designed to promote the program. Implementation of the marketing planning process involves establishment of programs and activities designed to communicate benefits of the service or program to patients. Forms of promotion include media releases, brochures, and pamphlets. Evaluation phase of the marketing process includes assessing reasons why clients are not using the service, program, or product. Be aware that procedures may include satisfaction surveys and interviews with clients. In summary, the effectiveness of any organization depends on strategic planning and marketing. The planning process is necessary to survive ongoing change and restructuring of the healthcare system. Marketing strategies play a vital role in healthcare settings to provide services and programs to the public.